Statement about the fall season and the virus. Totally misquoted.
You were accurately quoted, correct?
I'm accurately quoted in the Washington Post.
What Dr. Redfield clearly was asking for, just like we ask for every American to follow the guidelines, he's saying, please add to that guidelines getting your flu shot and making sure you're protected.
You say there's a good chance that COVID will not come back?
We don't
and
know.
If it comes back, it's in a very small confined area that we put out.
Well, the great thing is we'll be able to find it earlier this time.
That might not come back at all, Jeff. It may not come back at all. He's talking about a worst-case scenario where you have a big flu and you have some corona. But it's all possible. It's also possible it doesn't come back at all.
We will have coronavirus in the fall. I am convinced of that. There will be coronavirus in the fall.
So joining us now, Director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. He's the author of the book entitled Deadliest Enemy, Our War Against Killer Germs. So, Doctor, who's right, the president or his top doctors?
Well, first of all, let me just fine-tune the message and help you understand that right now, not more than 5% of the U.S. population has been infected with this virus. We know that this is a highly infectious virus. It'll keep transmitting into people. It will try to infect people till 60 or 70% of the population is infected. That's when we develop this herd immunity. So you can just do your own mental math from 5% to 60 to 70%. There's a lot of transmission left to come. It could even stay through the summer, into the fall, well into the following year. So it's here. There's no question about that. It's like the law of gravity. It's here. We're going to see a lot more transmission.
Do you share the concerns of Dr. Fauci and others that the fall and winter months may be the worst months like we saw in 1918, 1919 because of it coinciding with flu seasons? Does that present unique challenges that we need to prepare for today?
Yeah, I think the issue with now that this is a coronavirus, not a flu virus, we're not exactly sure where it's going to go next. I can tell you for certain it is going to infect millions and millions of more people in this country over the months ahead. We could very easily see huge peaks, much larger than we've seen already in this country, occur over the next 6 to 12 months. The bottom line message is that we could have multiple peaks. We could have one this summer, one later in the fall, one next spring. And again, just keep thinking of that number. 60 to 70% infected as opposed to the less than 5% now. So I think we have to prepare for those big peaks. Just exactly when they'll occur, I don't know. And I think that's important because I don't want people to come away and say if we don't have a fall peak like has been predicted that we were wrong. No, you will continue to see lots and lots of transmission. We have to prepare for that. We literally are in the second inning of a 9-inning game right now.
So, Doctor, how do we live through that? How does our economy get restarted? How do we survive that economically? How do we survive that socially? How do we survive that culturally as a country as we move forward over what likely will be at least an 18-month process?
Well, first of all, it's really important that we look at the leadership issue. And this is not a partisan statement. I've served roles in the last 5 presidential administrations. Here in the state of Minnesota, I worked for 2 Republican governors, 2 Democratic governors, 1 independent governor. No one can tell you my partisan politics. We need a fireside chat capability over the days and weeks ahead. Yep. Because it's going to be a really big challenge, and we've got to have a way for us to rally around that. That's the number 1 ingredient right now for getting through it. Number 2, we've got to greatly expand testing. We got to have people stop coming on shows like this saying test, 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 because we don't have any tests. The tests basically are limited by the number of reagents. We need a national initiative right now to figure out how to make these chemicals that then can do the test, because we do need to test. But we just don't have the capability. So that doesn't help. The second thing we have, in terms of public health programs we have to do is the contact tracing and follow-up will be important. We have to do that. The third thing, we've got to make sure that our hospitals are capable of handling these surges. That means also in protecting our healthcare workers. We are losing hundreds of healthcare workers on the job every day in these big outbreak areas because they're getting infected at work. So we've got to protect them. Those are all parts of then allowing society to move forward and keeping businesses as we can open. But until we do these other things, we're going to have a hard time reopening and staying reopened.
So, okay, minus the tests, all the other measures that you just mentioned, prepping hospitals, et cetera, does that create the potential for any type of scenario where we do not see the coronavirus in the fall?
No, we're going to see it. You know, it's like gravity. I can't emphasize this enough. There is not a debate here. I mean, if you want somebody to debate you on gravity, then you can have this debate. But the bottom line is, until we get 60 or 70% of the population infected, we are going to see this virus continue to spread. Look at countries like Singapore, where everybody held them out as the standard to say, look at, they've controlled this thing. They know how to do this. They know how to test and contact trace. They're now in a state of national emergency, where yesterday they had the highest number of cases reported. So again, this is going to be a constant battle. And whether we have a big peak this week or that week, we're going to have lots of peak activities where we're going to be highly challenged. That's what we have to mentally begin to prepare for, as well as all the administrative issues. And until we do that, we're going to be in this a fool's kind of position of assuming that, well, if we just bend the curve now, get into summer, we're okay. Please wake up, world. We are going to be in this for months to come, and that means we have to prepare accordingly.
Willie.
Dr. Osterholm, it's Willie Geist. Thanks for being on this morning and bringing some of that truth that you bring. I want to ask you about the state of Georgia specifically, because the President of the United States yesterday sort of turned on his heel and condemned Governor Kemp in Georgia for opening parts of the economy. That will begin tomorrow. Governor Kemp says some businesses can be open. Yesterday, in an interview up there in Minneapolis, you said that states like Georgia are headed for a train wreck. Could you be specific about what you mean there and game that out a little bit?
Well, first of all, anytime you're opening up in a situation where you already have cases increasing, where your systems are already overstressed, and now you're making it seem to people that they can, in fact, go out and have these close contacts, you're just adding gasoline to the fire. And so why? In a state like Minnesota, for example, we still have had challenges, but we've had incredibly high compliance with the distancing issues. We've actually been able to flatten this issue and slow it down. But had we not, we would have seen this this grow very quickly, too. So Georgia is really sitting on a situation where I think in 3 to 4 weeks it'll take that long for these cases to develop from people coming back out into the public and so forth. If they do that, remember, a governor saying they can open doesn't mean that they will open. I have a sense from my contacts in Georgia, a lot of them are actually questioning the governor's movement themselves. So I think that it's just a matter of, again, simple infectious disease epidemiology. Put your people in harm's way, they're going to be harmed. And that's what's going to happen in states like Georgia when they have the data showing the virus is still being transmitted.
And as we talk about testing, you pointed to something I was interested in, because I've heard this from emergency room doctors and ICU doctors who work in New York City, who I'm in close touch with, who report back after their long shifts there about false negatives in testing. You say 15 to 20% of coronavirus tests give a false negative. One ICU doctor I talked to said they're very worried about this idea of at-home testing, because people don't know how to use them. You have to be trained in how to test for coronavirus. So you could get more false negatives there and more people thinking they're free and clear and going out into society. So how should we be testing?
Well, first of all, let's just take a step back and realize we did run into a very serious situation when the CDC was not able to get the testing out that we needed early on. But then to play catch up, the FDA has basically, in many ways, backed away from the very responsibility that they should have of assuring that the tests that are on the market are effective and they work the way they can. Under this emergency authorization process, there are now at least 45 of these PCR tests, the kind that test for the virus, and over 90 antibody tests. And in those cases, many of these have not been vetted, have not been sufficiently investigated to know how well they work. We know with some of the antibody tests, as was described by one senior FDA official, a lot of these are crappy. So one of the things we have to do immediately is the FDA has to take control of this. Right now, it's the wild, wild west with what's available for testing. We have to assure we have the highest quality tests on the market. That'll help a lot. But even then, they're not going to be perfect tests, and we have to take a look carefully at how they're used. Right now, if you were to use the antibody test in most locations in this country, half of all the positives you would find would be false positives, telling people they're protected when they're not. Imagine if I told you, and you were a healthcare worker going into a room full of COVID virus that you wanted to be sure you're protected. You have positive antibody, but oh, by the way, 1 out of 2 chances it's not real. We've got to do better on these tests. And so, again, just test isn't the answer. 1, we've got to have tests. 2, they have to work. And number 3, we got to know how to use them. And we're not having that discussion yet. It's all about what the numbers of the day are. And that is not getting us to an effective and comprehensive testing program in this country, which we desperately need, by the way. We desperately need that.
So, Doctor, let's again talk about the roadmap. As we move forward, we're at 5% now. You say, probably about 5% of Americans have been infected. It's going to end up around 60, 70%. A lot more Americans are going to be infected. Many more Americans will die from this as we move forward, as we look at the numbers that you presented us today. So again, my question is, if you're a small business owner, what plans do you make moving forward over the next 18 months? If you're the father of children, as I am, that have underlying conditions that will mean that they'll be just in as much danger this fall when school starts back as they would have been this spring if I would have kept them in school. Mika's mom, 88, 89 years old, in as much danger this fall as she is now. So I understand we are following these lockdown orders. But again, knowing that we have to get from 5% to 60 or 70%, how do we do that while doing our best to keep our loved ones safe?
And you are asking exactly the perfect question that we need to be having a national discussion on, not these debates that we're seeing right now. We have put forward, for example, that we need to thread the rope through the needle. How do we open up bringing back the youngest of our populations, young adults and younger, where the frequency of serious illness or deaths is very, very low? Don't want to minimize it. It can happen. But in fact, are we going to continue to try to shelter those people in place for the next 18 or 20 months till we might have a vaccine? I don't think so. I think we have to start having these discussions. But on the other hand, we know that there are people who are very high risk of having a much more serious disease. How do we protect them? How do we protect nursing homes? Right now, we have basically thrown long-term care facilities to the wind. They are so ill-prepared to deal with this. This is one of the challenges we have right now. So we have to start having these discussions literally about how do we open back up, stay open in some cases, but at the same time bubble and protect those people who are at highest risk. You know, let's just be clear. This is a war. This is not a battle. We are going to take casualties for months to come. What we have to do is be thoughtful and wise. You and I don't want to be in that discussion where people have to figure out, do I give this person the vent or that person the vent? But at the same time, we're going to have those discussions on a population basis. Do we open back up enough so that we can actually sustain society, not just an economy? This is not about money versus lives. This is about maintaining a society that we have desperately needed to have to get us through this. And so I think, Joe, you're actually asking the billion-dollar question. I don't have all the answers here today, but I know until we have that discussion and people like you continue to ask these good questions, we're not even going to have that discussion. That's what's important right now. We've got to do that. It's about society as well as it is about those we love. And can I just add, my daughter is the head of the neonatal intensive care medicine at the University of Minnesota. She basically is in that room every day when women are delivering babies who are infected with this virus being exposed. I understand exactly where you're coming from.
Dr. Michael Osterholm, thank you so very much.
And please thank your daughter.
Thank you.
On behalf of all of us for what she does every day.
Thank you.
All right, we'll talk to you again soon, we hope.